So welcome everyone. Today is the introductory session for the Smoking Cessation Advanced Service in anticipation of the launch of a Mid Cheshire Hospital, the Leighton service going live. I'll go through the running order. So what we're going to hear through today, I'm going to do a little bit of introduction. You're not going to hear a massive amount from me today. A little bit on the introduction, and I come back later on for the PharmOutcomes. Tonight is about Alison Scowcroft, who's with us today to talk about the implementation, the status, and a little bit about the service itself. Hopefully, if a Mid Cheshire team come online, they're going to be able to join us and talk through their update from their cure team, as well as what they're going to be going through. Then, as I say, I'll do a very brief bit on PharmOutcomes and the processes there, and then we'll leave them quite a lot of time for Q&A. So hopefully we won't keep you too late tonight, but there will be plenty of time for any of your questions, and we won't cut any of them short if you've got questions that remain. Just a little bit around the housekeeping. This is a bit different than a normal Zoom meeting. We're using the webinar function. So basically only the presenters will actually appear on the screen and can talk. But what we do have is a really good question and answer function, which you can access through the screen at the bottom, that should look a little bit like you can see on the screen now. We will leave the majority of the questions to the end. However, if there's a really niche question that we'll ask that's specific to one pharmacy or specific to one element, we might well answer that live via text, but the majority will call out the questions and we'll answer them on the session at the end. I have set this session recording, so it is going to be a recorded session, and the plan is that we'll host this on YouTube, and it'll be useful for future trusts as they go live. One of the things this isn't going to do, is not going to repeat the PS&C resources. So this is almost a layer on top of the PS&C resources that's already there, just talking about the local information. There is some really good guidance on the PS&C website there, which I've linked on the slides, and all of these slides will be sent out. There's a contractor checklist, there's some good guidance, but it also does describe which equipment your consultation will need, which is in part of the training, and that's both for training and the equipment provision it's the contractor's responsibility to sort out. Welcome, Sue. I'm glad you've got on.
Hi, thank you.
I've done a broad introduction. You can see, I think if you click participants, you can have a look and see the attendees for tonight. It's the presenters appear on the screen, the rest don't. So that we do have access to the question and answer session as we go through.
I can't see the participants at the moment, but my two colleagues from Mid Cheshire tell me they're on. Are they on?
Who are your colleagues?
Joe Harding and Alison Berman.
I can't see either of those.
Right, okay, so I think they've done something different. I'll be in touch with them and tell them how to get on. Okay.
Well, what I'll do, if I hand over to Alison, who's got some slides around the CSU element of it, and if you need any tech support, just come through to me on text, and I'll try my best to help out.
Thanks, Adam. So thanks very much for joining us all this evening. I've just got a few slides to run through with you around the background of the Smoking Cessation Service, talking about the long-term plan and the Ottawa model of smoking cessation. I'll tell you a little bit about the pilot that we held over in Greater Manchester, and then update on the national implementation of the Smoking Cessation Service. So NHS long-term plan, I'm sure everybody's aware of what this is and what it does. Prevention is a core component of the NHS long-term plan, and this is what sets out the NHS's contribution to tackling tobacco dependence. So by 23-24, all people who are admitted to hospital who smoke will be offered NHS-funded tobacco treatment services, and that includes acute maternity and mental health trusts. So the long-term plan commitments are designed to be the NHS's contribution to helping to deliver a smoke-free generation. It's supposed to build on the good work that's already been delivered and to complement the current stop smoking services. There's a focus on both physical and mental health services, which is really important, and it introduces a level of national direction, but with local development and delivery. So we know that smoking cessation programmes already exist in community settings, but they are variable in their involvement of pharmacy, and I know there is a mixed bag in the Cheshire area in terms of locally commissioned stop smoking services through community pharmacy. So Sue and her colleagues at Leighton Hospital have adopted the Ottawa model of smoking cessation, and this has been adopted, as I said, throughout England in line with the NHS long-term plan. So what it requires is a follow-up of smoking cessation treatment after discharge from hospital. And the Ottawa model of smoking cessation shows quit rates increased by 11% in the 1-year quit rate, and it is expected to save the NHS £85 million within 1 year. Clearly, it's not all about saving money, but it's about saving people's lives and prevention. So the aim of the NHS Smoking Cessation Service is to support the delivery of the prevention ambitions in the NHS long-term plan, and for community pharmacy to become a nationally available choice for patients to access smoking cessation support post-discharge. As I mentioned, we had a couple of pilots that took place in 2021. And one of the pilots I was directly involved in the Royal Oldham Hospital in Greater Manchester. So we had a number of pharmacies who were involved in that pilot that were selected following an expression of interest process, giving good geographical coverage over the area and extended opening hours. There was a second pilot area that went live a little bit later on in Lambeth and Southwark in London, and that was working with both Guy's and St Thomas Hospital, as well as King's College Hospital. Both of those pilots have now transitioned into the National Smoking Cessation Service, which was launched at the beginning of March. This just gives you a little bit of an overview of the pilot outcomes from that pilot that I mentioned in Oldham. So just over a year, we had over 200 patients referred, and of those, 40% actually converted into being enrolled patients who were engaged with the Smoking Cessation Service and attended their registration appointment. The 4-week quit rate was around about 57%, so 46 of those 81 patients recorded a 4-week quit, and then we had 41% of patients recording a quit at 12 weeks, so 19 patients recording a 12-week quit. So those numbers were broadly in line with what was happening with patients who were referred to the community stop smoking service, and in line with expectations in terms of the outcomes from the referrals to community pharmacy. So really positive results. So as I mentioned, the pilot then transitioned into a nationally commissioned service. So NHS England worked with the National Centre for Smoking Cessation and Training, NCSCT, and they have developed a standard treatment programme which is bespoke to the SCS service. PSNC and NHS England obviously did lots of negotiation around the funding for the service, and it's confirmed that the consultation fees will be paid for nationally through the Community Pharmacy Contractual Framework, and the NRT costs for the service are recharged back to the ICB that comes from the primary care prescribing budget. The service specification was finalised and agreed, and as I mentioned earlier, the National Commission service was launched to align with National No Smoking Day back in March 22. It was an intentional soft launch, and pharmacy registrations did open with the BSA website on the 1st of March 22. Clearly, there's a lot of work involved for a trust team to get this pathway set up and implemented, and that's why we did a soft launch with in terms of allowing pharmacies to register to deliver the service, whilst the CSU is working in the background with trusts to help them to get the pathway implemented. So the role of the CSU then is in facilitating and supporting the implementation of the service. So initially there's some scoping and mapping, working closely with colleagues within the region and also within OHID, the Office of Health Improvement and Disparities, just to understand the position of each acute trust in terms of their delivery of the relevant parts of the long-term plan, where they're up to in implementing their tobacco dependence teams, and then identifying key stakeholders within trusts to support working groups. The CSU then support those working groups to facilitate the implementation at a local level. There is an advisor available for each region, and I'm your main contact for the Northwest. So we're responsible for ensuring those pilot sites have transitioned successfully and then engaging with early implementers of the long-term plan tobacco dependence teams, such as Sue and her colleagues at the Mid Cheshire Trust, and those sites who are looking to start delivery imminently. We've also got some supporting documents and materials to help with implementing the SCS pathway. So there's three kind of stages to go live from our perspective. So the first bit is that scoping and mapping that I mentioned, initial engagement with trusts who are ready to go ahead with the SCS pathway and establishing those working groups. Once we've got the key people around the table in the trust, then we look to talk about the pathway and identify exactly how those referrals are going to be sent from the trust to the community pharmacy. Once we've got that digital referral mechanism in place, then we're coming out to you guys in community pharmacy to do some engagement, working with the LPCs to ensure that everybody who's signed up to deliver the service with the BSA is ready to do so, agreeing those go live dates with Sue and her colleagues at the trust, and then ensuring that everything runs smoothly in the first couple of weeks once the trust goes live. Very simple pathway then, so I'm sure Sue will talk about this a little bit more when it comes to her section. So Sue's team will identify the hospital inpatients who are smokers and are supported with their quit attempt whilst they're an inpatient. At the point of discharge then, the patient will, there'll be a conversation between the trust team and the patient to ask them, do they want to continue their quit attempt post-discharge? And if they do, there are a number of options. So the patient can be referred into the locally commissioned service where that's available, or they can be referred to the community pharmacy through the SCS. Or it may be that there is no transfer of care and they want to continue their quit attempt unaided. So they are the options, and that is all around the patient choice as to where they feel they've been most likely to be supported. This is the model of care which is in the service specification. So hopefully everybody has seen this already. So the red boxes at the top is Sue and her team within the trust, supporting that patient who's been identified as a smoker on admission. The blue boxes in the middle are around that transfer of care, so having that conversation at discharge with the patient and then sending the electronic referral. Final step there, 5 in the blue boxes in the middle, is where the pharmacy makes contact with the patient who's been referred. And then we move into the green boxes at the bottom, which is when the patient has fully transitioned into the smoking cessation service delivered by the community pharmacy. And then that final box is the post-event messaging, which is used to update the trust around what's happened to that patient after referral. So we just wanted to pull out a few bits for you in community pharmacy, just to highlight some of the aspects of the service specification. So the SCS is intended to complement any existing locally commissioned services. You can only see patients in the SCS service who have been referred from the NHS Trust and who wish to initiate or continue their quit attempt post-discharge. It's really important that you make contact with that patient within 5 days of receipt of the referral, and you must make at least 3 attempts to contact the patient if you're struggling to get in touch with them. The 3rd attempt needs to also be on the 5th working day after the date that the referral was sent. So your timescales are really important here, because you want to make sure that that patient is followed up as soon as possible after discharge, because we know you've then got the best chances of engaging with them and helping them to continue with their quit attempt. You can provide support for the patient for up to 12 weeks, and your consultations, which must be no more than 2 weeks apart, so you can do them weekly or fortnightly. You can deliver those consultations either face-to-face or remotely, as per the pharmacy and the patient's needs. And your NRC supply, you can supply a maximum of 2 weeks at a time to that client from the agreed list of GSL products, which is listed in the drug tariff. So do check with that and make sure that you're supplying the products that are on the agreed list. You do need to make a clinical record of all service activity. The trust team are going to be using PharmOutcomes to send their referrals, so it makes sense that you also use PharmOutcomes to make that clinical record. Obviously, it is the community pharmacy's decision how they want to record that data. You should be offering carbon monoxide monitoring for any patients who you see face-to-face in your consultations. That will certainly help with the motivation of that patient in their quit attempt. And there are no charges to patients for this service. Even if they pay for their prescriptions, you're not required to take a prescription charge for any NRT supplies that you make. You need to make sure that the data which is required to be returned to the referring trust and to the patient's GP is sent back. So even though you're using PharmOutcomes, as far as I'm aware at the moment, there isn't any automated reporting. So there is a requirement to make sure that your sending that report and that information back to the referring trust using the data that you've entered into PharmOutcomes. In terms of fees, pharmacies who've registered to provide the service should have received a £1,000 setup fee, and that covers all the training, the NCSCT and the equipment that you need to have in place ready to start delivering the service. You then get paid £30 for that initial consultation with the patient. Each interim consultation is £10 and the last consultation is £40. So that can be any time from week 4 to week 12. You do need to submit your claims on the MYS portal. Again, it is a manual claiming process at the moment. It's not done automatically. So please do make sure that you look into completing your claims on a monthly basis. In terms of training, every pharmacy that's registered to deliver the service should already have completed that, because that's part of your service registration. But just to refresh on this one, you need to have completed your NCSCT Stop Smoking Practitioner certification. If you've already got that in place from a locally commissioned service, then you don't need to repeat that training. There's also some additional modules on NCSCT around supporting treatment for people with a mental health condition, pregnant women, and also e-cigarettes. So you need to complete those ones as well. As I mentioned earlier, there is an NCSCT standard treatment programme which is used to support consultations in the SCS service. It's a really valuable resource, so I'd really recommend that you familiarise yourself with the contents of that standard treatment programme. And you also need a carbon monoxide monitor, which is on the approved list on the PSNC website that Adam mentioned earlier, as well as a SOP in place to sign up on the BSA website. In terms of what's happening in your area, so looking across the whole of Cheshire and Mersey, we've got Liverpool University Hospitals NHS Foundation Trust already live. They went live back in August. And then Sue and her team at Mid Cheshire are going to be going live in the next day or two. So you are the second trust within Cheshire and Mersey to go live. So we've got conversations ongoing with some of the other trusts. Wirral University is the other one that's making good progress. And obviously everybody on the list we will get around to at some point within the next 12 months or so. This is just a screenshot from the mapping dashboard that we've got on the CSU website around pharmacies that are signed up to deliver the service. The green blobs are those which are live and accepting referrals from Liverpool University's Foundation Trust, and the amber blobs are those who are signed up to deliver the service but not currently live. I know that Cheshire CPCW LPC also has a similar map on their website which shows signed up pharmacies, which is a really helpful resource that Adam and the team are keeping up to date. Thank you very much. So in terms of in your area, as I mentioned, we've got Luft already live, Sue and the team due to go live and attending today. So one of the purposes of today's session was just to ensure that community pharmacies in the area are comfortable with the service provision, and also making sure that we've got enough pharmacy sign-ups to cover the geography ready for Sue and her team to refer to. So there's a couple of references there. Adam's already mentioned the PSNC page. There's a link to the service spec and also to the standard treatment programme there, which is useful for you. So that's everything from me for the time being. I will hand over back to Adam, who will take you through the next section of the slide deck. Thank you.
Well, actually, it's to Sue and the team to tell us what's about the Cure programme at Mid Cheshire. So, welcome, Sue. Sue, do you want to introduce yourself and your team and take?
I do, yes. So I'm Sue. I'm currently employed as the sort of project manager, team lead for the Cure service here at Leighton Hospital, the tobacco dependency stroke addiction service. And with me on the call today, I've got Joe Harding. Maybe want to wave, Joe. And somewhere I think I've got Alison as well. I'm not sure where. I can't see Alison, but I think she's on. And Alison and Joe are tobacco addiction specialist nurses employed within the service. We were hoping to have Kate, our support worker. Unfortunately, she's had to take emergency leave today. So just a little bit about Cure here at Mid Cheshire, really. And I don't know how much people on the call know about Cure as such, but Cure was a model of tobacco dependency support that was implemented in Manchester and came from the Ottawa model, and was a model that our organisation decided to adopt. We started way back in 2020, seems like a long time ago now. We launched with a sort of soft launch in November 2020, and then full launch was January 2021. And of course, we were in the throes of the sort of COVID situation was escalating again around, that time. So it did mean that sometimes we were pulled from this service to support COVID, the COVID needs, vaccination, etc. So I would say our sort of full implementation came in about April 2021. And we cover both East and West Cheshire patients, because in our hospital, in Mid Cheshire Hospitals, 2/3 of our patients will be from the East Cheshire area and 1/3 will be from the West Cheshire area. The West Cheshire area being sort of Northwich, Winsford, and that side of the patch really, so not the whole of West Cheshire. We currently, from inpatient, see around 2,000 patients plus per year. And when I say we currently see that many, that's the number of lives, if you like, we touch by going to patients at the bedside. People are either referred to us or so 2,000 plus per year for our small team. And of those, approximately 60% get onboarded to a sort of quit programme. Over the last sort of 2 years, we've been keeping patients for up to 12 weeks on our programme, because we didn't have any community services at all to refer our patients into. And so of those that were onboarded, the 900 so plus that came on board, about 48% quit 4 weeks plus. So we were doing really well. Earlier sort of this year, we then sort of gained, I think it was around July time, we agreed process with West Cheshire Local Authority Service. So those patients, with East Cheshire Local Authority, those patients from that area, given the option to go to the East Cheshire Community Service at the 1 to 2 week mark, when we do follow-up calls after they've been discharged, and quite a few do prefer to go to a community service, and we've got a process for referring those people on. We haven't yet got a process for referring people into West Cheshire services. There is a local authority service in West Cheshire, but we haven't yet agreed that we can do direct referrals into those services. It's very much down to patient self-referral. So the advent of the pharmacy service, particularly in the West Cheshire side, is going to be really important, I think, in giving our patients choice about having support in the community, rather than coming over to Leighton Hospital to collect therapies, etc. What we do know is, to say, we're seeing about 2,000 patients, and about 900 of those are onboarded. From audit that we've done internally, we probably are only seeing about 50% of smokers currently. We feel there's probably another 2,000 patients out there. But because we aren't electronic patient records in our hospital, we have to rely on either referrals to us, or we go out and seek patients by looking in patients' notes and engaging with clinical teams. We know from audit we are missing a big number of patients. So we feel that by being able to hand off patients to community should be a benefit in releasing some of our time to get out on the shop floor more, rather than doing follow-up phone calls to patients. I suppose, if I'm honest, we have got an anxiety, and we've shared those anxieties with both Adam and Alison before now, that we've had this sort of good success rate, and we've got an anxiety that we're handing people off to other services, and will that success rate continue? Not that's not for us. It's about the people, you know, it's about patients, and you know, we're really, really keen that they get the right level of support in order to continue that journey. And I have to say, from all the discussions I've had with the central teams about this pharmacy service, I think my team will tell you I've been really impressed with some of the information that's been given to me about training, about support, and about outcomes. So we are really looking forward to having a pharmacy service available out there for our patients, gives them more choice, and to seeing some great outcomes from that as well. I don't know whether Joe or Ali, you want to add anything to that. I will just say we are currently a 5-day commission service, but from the 1st of October we started to trial a 7-day service. We will be a 7-day service from April next year. We are expected to be, but we are currently just trialing a 7-day service, which, you know, hopefully will help us identify even more patients. Joe, have you got anything, or Ali, to add?
No, not really. I think it will give patients a much greater choice of where they can go. They do struggle, especially on the west, like you said, to come back to Leighton to collect patches, etc., especially if they're poorly and they're having treatments elsewhere. It's just, you know, a bind, isn't it, coming over to Leighton? So I think being able to go to the local pharmacy will be a great help for them, really do. So yeah, looking forward to it. Should be interesting.
Well,
Quite excited about it.
Yeah.
I think your accessibility is going to be really, really helpful, actually, in terms of getting out there. And I think your numbers are quite impressive, because if you've got 2,000 and you're onboarding 60% of them. And
sorry, I meant to say 40-odd%.
900,
but, you know,
said,
it's not bad, about 900 at our latest count. Yeah,
if that's only half of them, then we should be able to get the pharmacies enough. So this is routine, so they're checking their PharmOutcomes on a regular basis. They're used to getting patients through. Because one of the things we often see with pharmacy services is if there isn't that regular throughput, then that's where the blips are. So it's making sure there is a feed through, and there's almost a routine within the pharmacy team to check it all the time, which would be fantastic. So that's really encouraging to hear the numbers.
Yeah, and I think one of the positive things, certainly about the West Cheshire side, in terms of the pharmacy services that are onboarded, is that the West Cheshire Local Authority Commission Service, although they are going to be, we are working with them to allow us to refer into their service, they have asked us to try and talk to patients about going to pharmacies first, because they haven't got the resource really to, that's why we're struggling to get them to accept our patients. They haven't really got the resources to be able to see these numbers. So I think, you know, we will be, you know, it will be one of, you know, we're really pressing the pharmacy side of things. And looking at some of the locations, I think, you know, these are the areas where Barnton, God, you know, our patients, it's about an hour's journey from Barnton to Leighton, and that's on good run, you know. So those people are going to, I think, really benefit.
Well, and I think we'll see, you know, Alison mentioned earlier about the maps on our website for which pharmacies are there. Our Alison keeps that up to date really regularly. She does a fantastic job of that. And I think as we see the services go live, we'll see more and more pharmacies come on board, because obviously I think quite a few of them are waiting to say, when are the referrals going to start? So this is part of that journey in informing them and letting them know what's what. So that'll be really helpful.
Alison, have you got anything? Are you on the call?
I think the signal's really poor, so
yeah, she's struggling a bit.
I think she's got half a screen at the minute or something.
Right. Okay.
Bless her.
No worries.
Oh.
Yeah. Oh, Ali, I think it has.
No. Oh.
But
she's really struggling with her internet connection.
Can you hear me?
We can sort of hear you, but that's a bit better.
You're echoing a bit, Ali.
I can hear you. I can hear what's going on, so that's fine.
Good. Okay.
If you've got any questions or anything to add, Ali, put it in the chat.
Brilliant. What I'll do if I go
Yeah,
on.
I can hear you. All fine. Okay.
Brilliant. Thanks, Ali.
Gosh.
What I'll do, I'll go on and I'll do the farm outcomes bit, and then we'll open the floor up to anyone who has a question or anyone who's got a query to ask it if they want to. And we'll see what's what at the end there and give all the links out. And or as I say, all of the slides you've seen, all of the links that you've seen, they'll be distributed after the event, probably tomorrow now, to go through. So in terms of the farm outcomes bit of it, the things I really want to cover is so this service, it always starts with a referral. There's got to be a referral electronically. For Leighton, this will be used through PharmOutcomes, which is really, really helpful because that's the tool that we're most used to using in community pharmacy for such services. And we hope most of the other hospitals that you saw on that chart that Alison put up earlier, we hope that will be the same as we go through. Obviously, this video is recorded to let people for other hospitals go through and to hear that, but it may well be different. So each hospital, you'll have to check exactly how you're going to be receiving the referrals. NHS Mail is the only other likely one, I think, that we're likely to see up here. In terms of the pathway, I'll put it on the screen there. So in terms of how it works, the hospital will send a referral in. The PharmOutcomes module will automatically then, within the service operation, notify the general practice, notify the trust at various points. It will capture patient consent once the patient's in the pathway with the pharmacy to do that. And the whole provision is able to be recorded on there if the pharmacy wishes to. Alison mentioned earlier about the manual claim on MYS. It is a manual claim. However, there's a report that you can pull off, and I'll show you a guide on that in a moment that will make that a little bit easier. And eventually there will be an option to submit a claim automatically and have that MYS link in place. I think the Smoking Cessation Service is one of the services that's next in the queue for that linkage to happen. I know we're all desperate for the DMS to go there, but I think actually smoking cessation will beat that. There will be a fee involved, so it gets a little bit complicated with the model, and I'll talk to you a little bit around that. So in terms of the model itself, the templates are available to all pharmacies that have signed up to deliver the service. That's thank you to NHS England, who commissioned PharmOutcomes right the way across our geography in Cheshire and Merseyside, as well as the LPCs together who've worked to put that licence together and to make that available. In terms of the services themselves, there's a linked set of recording that takes you through all of the different stages of the intervals and of the intervention. So that starts off at the initial intervention. It's linked to the referral received, so you can accept that and bring the patient into your service. There's then interim appointment templates that you use for either the weekly or the fortnightly visits to support. There's 4 and 12-week quit templates to record the outcomes at that stages. There is also an onward referral mechanic, which either can send to another pharmacy via PharmOutcomes or via nhs.net. And there's also a mechanism to record referrals received by pharmacy via NHS Mail rather than through the system. For those that really need the detail on the PharmOutcomes module, I'm not going to replay it now, but there's a video we did when Liverpool went live on our YouTube channel. I'll put the link out when we send all the information out, and it's actually got Matt talking us through the individual screens on the PharmOutcomes template, if that's what you feel you need. I don't think anyone who's using PharmOutcomes on a day-to-day basis, I don't think it'd be particularly complicated and particularly unusual based on what you will have seen before, but it is there. In terms of the cost element, I did mention where we are. So the initial use of the system won't be chargeable. However, once that linkage to MYS is in place, there will be a differential. So if pharmacy chooses to use the MYS link, then there will be a fee paid per provision. So contractors will have a choice to make whether they utilize just the templates and fill in their MYS template manually, or whether they actually use a transactional fee to use it, along the same lines as we do with the community pharmacist consultation service fees, with affinity groups, discounts applying and all that side of things. But that will be there. Contractors will have the option to not be charged. However, we're anticipating that probably most will want to do the claim management element of it. There's a few details there about those charges. Most of that's the stuff I've explained in terms of there will be notice on when it's going to happen, and pharmacies will have a choice on whether they stick with the stick with the free option, or they actually carry on with the full claim management functionality as it goes through. We don't yet have the exact timelines on when this is going to occur. As soon as we do have that, we'll put that in our newsletters so that everyone can know. Couple of resources just to highlight to you. There is that video guide. There's the link I was telling you about from the YouTube video launch. That was the one for Liverpool where Matt did it. But there is also some provider guides on PharmOutcomes which have gone live. They're a bit difficult to find. If you go onto the PharmOutcomes homepage and click Contact Us, there's then provider support guides, which if you drill down into specific service delivery guides, then there's a smoking cessation link that takes you there. So it's a little bit awkward to find, but it is there once you find out and you navigate through it. That's probably it for a whistle tour of the PharmOutcomes element. What I'll do, I'll switch the screen off, and if you've got any questions, please go ahead and either use a chat function or the question and answer function, and we'll give it a few minutes after the questions have dried up, and then we'll close the evening if there's nothing else. So if anyone got any questions or any queries that they'd like to ask of the team while we're here together.
Could I just add something in, Adam, about the reporting from PharmOutcomes? I think it's safe to say that it's still a little bit in progress with regards to Pinnacle setting that reporting functionality up. So I think we just need to be mindful that there is a requirement in the service spec for pharmacies to report back to the trust, and I wish I could say with 100% clarity exactly what it is that PharmOutcomes does to help you as a community pharmacy in terms of that reporting, but it's still, the picture is still a little bit unclear, because there's a difference between patient level reporting with patient identifiable data included versus kind of aggregated reporting, which can be accessed directly through PharmOutcomes. So for the time being, and for the the first referrals that you start to receive from Sue and her team, it may be that you need to do some more manual reporting whilst the PharmOutcomes stuff is set up. So just please be aware of what the requirements are in the appendices of the service specification. And if that's not being sent directly through PharmOutcomes, I haven't looked at those guides, Adam, so it might be useful for me to look at that in PharmOutcomes. Just make sure that you are fulfilling your reporting requirements in the service spec.
That's really good counsel, thank you. I've not looked at the report itself because we've not got live yet, but I have looked at a guide, and it probably insinuates it's a little bit more richly set up than you've described. So that's good counsel.
The other bit that might be helpful as well, Adam, and I don't know, Sue, if this is something that you could facilitate, is the LPC having access to PharmOutcomes and able to support with any referrals and monitoring the activity. I don't know if that's something that Pinnacle could help to set up, and if Adam and the team would be happy for that. Yeah,
we're more than happy. We do that with many services, and I'll get Alison from our team just to check if we've not got the access to and the visibility. What we'll do is we'll request that access from Pinnacle, who will then go to the trust to ask permission to share, which is probably the best way round of doing it. So I'll take that action on.
Thanks, Adam.
One query I've had in via text, got all these functionalities come in, but someone's texted me. That's how the world works. There's a question around the service and the use of non-pharmacists to provide the service. Does anyone know the answer to that and any of the dates and when that's going to be possible, or do you want me to?
Yeah, so it was confirmed a couple of weeks ago now, wasn't it, that pharmacy technicians were going to be included in provision of the SCS service. along with hypertension case finding, which is really beneficial, I think, to community pharmacy. So it takes some of that pressure off the pharmacist in terms of delivery of the service. There needs to be a change to the service specification to allow pharmacy technicians to deliver, and there also needs to be some changes made to the underlying legislation of the Nationally Commissioned Advanced Service, and these things don't take an inconsiderable amount of time. The latest update that I received was on a PSNC webinar a couple of weeks ago, and they expected to have that in place by the end of the year. I don't know if you've had any further updates on that, Adam, or if that's your understanding in terms of timescales.
Yeah, that's broadly mine as well. Autumn to winter was when I was told. There is actually a piece, if you go onto the PSNC website, there is actually a piece around the training requirements, and it says just that at the moment we don't have a date, and it'll be released on the PSNC website as a news article as soon as we do. We will amplify that in the LPC newsletter, because we think it'd be really important. It's likely probably to be a cascade of multiple services at the same time with the way the legislation's run. So you would struggle to miss that announcement. I think the amount of times it will get amplified and hammered home. So we'll make sure people are aware of that when it comes through. Brill. Any more questions from anyone who's watching on the webinar tonight?
It's just a couple of things from me, Adam, that I just will sort of highlight whilst I'm on. So if the reporting is going to take a little while to get those reports set up, coming back to trusts, probably going to need to link you up with our BIU. They're currently working with East Cheshire to get reports back from them on any patients that have been referred to that service. So I'll link you up with the relevant person in BIU here to make sure we're getting what data we need. It's not going to be straight away, of course. It'll be, I think it's a couple of months behind, if I remember rightly. It's not something that's immediate. So just to be aware of that.
I think the patient level reporting back to the trust and to the general practice is okay.
Oh, is it? Right. Okay. Sorry, that's my mistake. Yeah.
Yeah, there's an aggregated report that then pharmacies can use to claim.
Right. Right. Okay.
That's a bit clumsy and a bit clunky and not in the format that it needs to be. But the individual patient level with consent is, as I understand it, that's working okay for Liverpool at the moment. So
brilliant, that's great. And the other thing was, I know you've sent this through before from our conversations, but something that we as a team talked about when we're talking to patients, it's going to be really important that we can actually see what pharmacies are currently live and what they can and who they can access. So we just, again, if you could send us that link to so that we can click on and find which pharmacy local to a patient, so that we can tell them that, because we know we can do it when we get into PharmOutcomes and the pharmacies will be there, but we actually want to have the conversations before we get to the point, really.
Well, I'll get that sent across to you now, Sue.
Thank you, that's great. We'll save that link then. That's the link that will be updated regularly by your Alison, isn't it?
Yeah, I mean, if you're ever struggling, it is just our website. Yeah. You should be able to get to the Smoking Cessation Service for that.
Okay.
So I'll ping it across to you now and you can stash that away safely.
Fantastic. So my understanding from our trust point of view is that we're kind of almost ready. I did have a meet today with Katie Assels, do you remember? Yeah, and signing off SLAs with the right people, and EMIS. So there was a few questions that have gone back to EMIS just around that, and as soon as that's signed off, then I think we're pretty much good to go. I think the information governance has all been signed off now, and yeah, so that's all good.
Once you have that final sign off and that actual date, just drop us an email. We'll make sure we just send a note out to pharmacy to say, right, it could be today. Yeah. Please make sure you're checking alongside the other services they check for.
Fantastic.
So we can make sure that's the case.
I think as well, we'll probably do a bit of a tweet about it the day it goes live, try and get some conversation going on Twitter and Facebook and what have you, which is what we normally do with anything new within our service. So if you've got a handle you want us to link into, let us know as well.
Yeah, I think it's CPCW.
Right.
It's out there anyway, so
Yeah.
we'll make sure we retweet it and broadcast that too.
Yeah.
Brill. I've no other questions coming in. Obviously, if you do, once the webinar's finished, if someone thinks of some questions that we've missed or that you'd like to submit, then let us know. If you come through to support@cpcw.org.uk, we'll make sure they go to the appropriate person and it comes through. Like I say, we'll host this on YouTube, so any contractors who aren't here tonight will be able to view it, and we'll store it as a bit of a repository for when the other hospitals go live as well, because there'll be some local information relevant as well to the information. One of the things we'll be doing is as I click close on this webinar and you leave, it should pop up on a web browser with a survey option. If it doesn't, you will get an email, but we're really keen from a contractor's point of view, what's worked well, what's not worked so well, just so we can learn and we can do these better as time goes on. So if there's nothing else from anyone, which there doesn't look like there's any questions either in the boxes or in the chat, then thank you everyone. Thank you so much for coming along and presenting to our pharmacies, and best of luck as we all goes live. I think it
thank you.
should be a very good service for patients.
Thank you. Bye.
Brilliant.
Thanks very much.
Thanks. Bye.
Good night,
Bye.
everyone.
Bye-bye.